So we are honored to have you all here. We are so thankful for you to making time out of your busy schedule to participate in this session. So for those who have joined us, this roundtable will have Dr. Peter Fenwick, Dr. Harold Koenig, Dr. Alexander Moreira, who participated minutes ago in the Q&A session. So I'm going to read, they have a very, very long bio, and I had shortened it, so apologize for that, but just for the sake of time. So Dr. Peter Fenwick is the consultant neuropsychiatrist emeritus to the epilepsy unit at the Maudsley Hospital, which he ran for 20 years. He is presently emeritus senior lecturer at the Institute of Psychiatry, King College, London. Dr. Fenwick has a long-standing interest in brain function and the problem of consciousness, and has published a large number of research papers related to altered states of consciousness, near-death experiences, and of life experiences, in the process of dying. He has researched into meditation and continues to be interested in the relationship between meditative states, cognition, and brain function. Dr. Alexander Moreira is an associate professor of psychiatry and director of the Research Center in Spirituality and Health in the School of Medicine at the Federal University of Juiz de Fora in Brazil. He's currently the chair of the section on spirituality of the Latin America Psychiatric Association. And he's also a former chair of the sections on religion, spirituality, and psychiatry of the World Psychiatric Association and the Brazilian Psychiatric Association. He has been a scientific mentor for a number of researchers in his university, and also collaborating with several top researchers in this area, like Dr. Koenig and Dr. Fenwick. So he has been a leader of research in spirituality from Brazil and is known all over the world. Dr. Koenig is the board certified in general psychiatry and formerly family medicine, geriatric medicine, and geriatric psychiatry. He's a professor of psychiatry and behavioral sciences and associate professor of medicine at Duke University Medical Center. He also holds professorship positions at university in Saudi Arabia and China. Dr. Koenig is the director of Duke's Center for Spirituality, Theology, and Health, and has published extensively in the fields of religion, spirituality, and health, with over 500 scientific peer-reviewed publications, books, book chapters, more than 50 books on print, probably now much more in preparation or in for publication. His research on religion and health has been featured in many TV news and journals and national and internationally newspapers, magazines, etc. Dr. Koenig has given testimony before the U.S. Senate and the U.S. House of Representatives concerning the benefits of religion and spirituality on public health. And I apologize, I spoke too fast. We have to remind ourselves that we have to facilitate the life of the interpreters. We have interpreters for Portuguese, Spanish, and German. So I'll try to remind myself of that, and I'll be reminding you all to speak a little slower. So we are going to give about 10 minutes for each one to give a summary of your latest research or anything that you find relevant. We can only give you a full time for because we want to go into questions and answers and make this a more interactive session. So please, let's start with Dr. Koenig. If you want to share in about 10 minutes, in a nutshell, what is, the relevance of the research you have been doing.
Thank you. Thank you, Sonia. It's a pleasure to be able to talk with you and everyone who's listening and watching about this topic of religion, spirituality, and health. Alexander has been a close colleague of mine for many years, and I've read much about Dr. Fenwick's work as well. These are tremendous scientists that I'm just very pleased to be able to be on the panel with. So my area of research is looking at this connection between religion and health, religious beliefs and practices, and people's mental health, their health, their behavioral health, their physical health. So really all different aspects of health. Religious involvement seems to influence in one way or another. Right now, I think one of the greatest priorities of the field of religion and health is training young investigators to learn the skills necessary to conduct research. So research is really important in terms of beginning to integrate religion and spirituality into the actual care of patients. So research is really where it all begins. Research informs clinicians on treatments, on things that they should ask about that might affect the person's health and their well-being. So research is absolutely critical, but people cannot do research unless they are trained. And getting the training is absolutely essential. And to have young people getting involved in this field. So the training is essential because research is very complex. Conducting good research that ends up being published in a peer-reviewed journal requires lots and lots of training in the design of studies, in carrying out of the study, management of a study, in the analysis of the data, and in the writing of the paper for publication in a way that is accessible to readers and reviewers. So that research, people need training to do that. We have a 5-day research workshop here at Duke University where we really train people to do research specifically in the. It's held every year in the summer. And in fact, it's also held in Europe. There's a 4-day workshop that we do with the European Society for Religion, Spirituality, and Health. And so I would encourage, young people interested in this area to get the training, and to come to one of our workshops to learn about this research and to get the training, because it's going to be research that determines whether or not any of this information gets out actually into clinical practice, and also not only into clinical practice, but into the public, because the public needs to know about this as well. And there are lots of individuals who are interested in this topic. You know, this is particularly important at a time when religious beliefs and practices around the world are becoming less common with each generation, as younger people are not attending religious services as frequently. They're not involving in more traditional forms of religious beliefs and practices that have been shown to be connected with better health. Instead, many are getting involved in areas of spirituality that are not good for their health, that are focused primarily on themselves. One of the best indicators of that is a recent book called Strange Rites. Strange Rites, R-I-T-E-S. You know, when God is replaced by something else in society, there are problems that develop, particularly with regard to health and well-being, and well-being of entire countries and cultures. So it is important for us to be able to document the benefits that religious involvement currently have for people's health. Public health issue that needs to be addressed. That's why I'm so excited about this particular conference, in informing people about about the research and answering questions that people might have. And I'm hoping that some of the people in this audience will get excited enough about this topic to actually decide to develop an academic research career or teaching career, really focused on this issue. I was thrilled to have Alexander with me for a year here at Duke University. And this was, I don't know, 5 or 10 years ago, but it was very exciting to
15 years ago.
How long?
15 years ago.
Oh my gosh, I can't believe it. I can't believe it's been that long. Oh my gosh. Anyway, so we've been close colleagues ever since, and have had a lot of fun in that regard. So I would welcome younger investigators to join our group, you know, to get involved in this research. It's been one of the most, well, it has been the most rewarding aspect of my entire career, is this research and training others to do it.
Thank you very much, Dr. Koenig. We'll continue talking about that when we come to the questions. Let's ask Dr. Moreira Almeida to give some 10 minutes nutshell on his research or anything you find relevant.
Okay. So good afternoon, good morning, or good night to everyone around the globe that are watching us. It's a great pleasure being here with my dear mentor, Dr. Harold Koenig. I'm extremely grateful to him for all his kindness, guidance, not only that time 15 years ago, but throughout this time. I'm very grateful. Thank you very much. And also to be here with Professor Peter Fenwick, who has also been very supportive of our research. But most of all, I'd like to thank you both for opening the scientific field to these discussions. I think both of you open in different perspectives and help us to enlarge the scientific environment mindset, to understand and respect fully the spiritual side of human beings. And much of what we have nowadays, we are in debt to Professor Harold Koenig and Professor Peter Fenwick. Professor Harold Koenig was essential in helping us to understand the actual importance to the current population of religion and spirituality. That religion and spirituality is very important for most people around the globe, and also it impacts health. So we must pay attention to it. I think that is the bottom line of the message. That nowadays this message we take it for granted, but we know that it took 40 years of very, very hard and competent work. And on the other side, Professor Peter Fenwick, one of the leaders of studies of spiritual experience, like near-death experience, end-of-life experience, showing that probably just brain activity is not enough to explain this experience. We cannot say anymore that these spiritual experiences are nothing but chemical or electrical brain activity. So I think Peter Fenwick was essential in this. So I'm very, very grateful to you, because I now have the path opened by both of you. So it's much easier to follow the steps of both of you. So I think these are the situation that we have now, and in what I think are now the main challenges. How can we are receiving the torch from them, and how can we move forward? And I think one very important aspect is how we can make clinical integration, clinical application of this knowledge, and how to train clinicians and researchers in this field. About training researchers, Professor Koenig has already explained about, but of course, it's very important to training clinicians. I think this is very, very important. And in trying to help in this direction, we have, for example, worked on a curriculum on spirituality for psychiatry residents, and we are doing this in partnership with Professor John Petit from Harvard. And we are now implementing this curriculum in 12 different psychiatry residence programs in Brazil, and we hope to have very soon results and be able to provide good evidence that we can train psychiatry residents to address in a better way spirituality. I think this is one very important aspect. The other aspect, more related to the research line of Peter Fenwick, is regarding to the understanding of the nature of spiritual experience. I think this is very, very important, and we also have worked on this aspect in trying to investigate spiritual experience like near-death experiences, end-of-life experiences, trance experiences, and many others. And we have done research on the phenomenology of these experiences. We have done research on neuroimaging, functional MRI and spectrum. We have investigated that. We are now currently investigating the exome, the genetics of trance mediums. We are now collecting a sample of 100 mediums around Brazil, more experienced mediums and their relatives, non-mediums, and we'll compare the genetic expressions and see if we could find some variants. And finally, I think the most challenging aspect of spiritual experiences is investigating the nature of these spiritual experiences. Can we just explain all the spiritual experiences through psychological, sociological, and biological factors, or do we also need some transcendental aspect for this experience? When a person has deathbed vision, for example, it's just a brain activation or wishful thinking. Of course, it can be these aspects, but what about if it is actually some kind of actual connection with some non-physical transcendental dimension? So I think we need to be open to this perspective. We as scientists, we need to stick to the facts, not to our dogmas. Of course, each of us as researchers, we have our own perspectives, but we cannot be dogmatic about them. So we need to be open to these different possibilities and not just ignore what does not fit with our framework, with our mindset and things like that. So I think this kind of perspectives and showing that considering the transcendental aspect of reality, of consciousness, of mind, is not abandon science. On the opposite, we are proposing a true science, a kind of expanded naturalism. The nature could be more than just physical force and particles. The consciousness could be something fundamental, irreducible in nature. So we can take this in consideration and investigate them. So this is one of our major goals recently also. Thank you very much. I will be glad to discuss with the colleagues and our audience.
Thank you very much, Dr. Moreira Almeida. We are now going to ask Dr. Fenwick to give us, like in 10 minutes or so, some of your perspectives on what we are discussing today. I apologize. Dr. Fenwick was so kind. He prepared some slides, but today we will not have time for the slides. So I really apologize for that. But please give us like a 10 minutes overview. You have so much important research, and we would like to hear that before we go on to questions.
Oh, it's a pity about the slides, Sonia, because they're all very quick, and if we can't show them, we can't show them. It's timed for 10 minutes. I'd like to thank you very much for inviting me here, and very nice to meet Alexandra again, who I know well, and Harold. You don't know this because I was very junior, but in Brazil, must be about 20 years ago, when you gave a talk, I heard it and thought, wow, that's really important. Now then, what I am going to do, because I fortunately have my PowerPoint here.
I can ask to share your PowerPoint.
You can?
Yeah. Some of our texts, they have your PowerPoint, and we can share it quickly.
Oh, good. They're very short.
If you just hold for a second.
And Dr. Fenwick, just to let you know
okay.
Just one small comment. Dr. Fenwick, that time that you watched the Hard Koenig's presentation in Brazil, it was also the first time that I met him, and I asked for the possibility to visit him at Duke University during my PhD. So I first went there. So that meeting was very, very important in different perspectives.
It was a great conference, that one.
Yeah,
I
that
very
was
much enjoyed it.
Very important time.
I think it was 2003. I think.
Okay, here you are. They're very quick, but there are 4 points I want to make. This is Russell Wallace, a great explorer. Truth is born into this world with pangs and tribulations, and every fresh truth is received unwillingly. Remember that. People don't like new things. And here are some examples of this. The Edinburgh Review called upon the public to put Thomas Gray in a straitjacket for maintaining the practicability of railroads. Next. I mean, they're too fascinating for words. When Stephenson proposed to use locomotives on the Liverpool-Manchester Railway, learned men, note, learned men gave evidence that it was impossible they could go even 12 miles per hour. Next slide. And there's a nice sort of slide for you. Okay, next, just a picture. When Benjamin Franklin, great scientist, brought the subject of lightning conductors before the Royal Society, he was laughed at as a dreamer. And note, his paper was not admitted to the philosophical transactions. It's astonishing. Absolutely astonishing. Next, please. And finally, Thomas Young, the discoverer of light and describer of life. When Young put forward his wonderful proofs of the undulatory theory of light, which we've heard about in this conference, he was hooted at as absurd by the popular scientific writers of the day. The Edinburgh Review commented on the theory containing more fancies, more blunders, more unfounded hypotheses, more gratuitous fiction than you would possibly believe in. Astonishing. And this is one of the main theories of light now. And finally, Humphrey Davy, another person, a scientist, laughed at the idea of London ever being lighted with gas. So there you are. Next slide, please. What we need to say, has anything changed or is it changing? This is the Times, 2006. Theories of telepathy and afterlife caused an uproar at the time top science forum. Next, please. The disputed session featured research from Rupert Sheldrake, who claims to have found evidence that some people know telepathically who is calling them before they answer the phone. But we all know that. Next. And then other presentations come from, I don't know who this guy is, somebody called Peter Fenwick, a doctor who thinks deathbed visions suggest that consciousness survives when people die. Astonishing. This is in the Times in 2006. Next, please. And Lord Winston on telepathy. I know of no serious, properly done studies which make me feel that this is anything other than nonsense. It is perfectly reasonable to have sessions. We must have somebody from our own field to criticize it. In other words, have somebody who knows nothing about it, talk about it and say this knows nothing about it and it can't be there. Fascinating. That is 2006 and that's the time. Next Times. Next, please. But things are changing, and I agree with Alexander, and I agree with Harold and Celia too, that what we're thinking about now is a spreading out of and a weakening of the bastions of physical society, of reductionist science. Three things, very quickly. This is what I'm doing at the moment. This is a man called Alain Forget, who's a Frenchman, spent his life meditating and can alter his mind so as to give light. Everybody sees it. Next slide. Is it our imagination when we look at him and see light? No, it's not. That graph on the left shows that his brain waves change enormously. Next, please. So, can he give life? Can he transmit his light over long distances? Yes, here's the proof. This is, he was in Monaco, transmitted his light to Wales, where it was then zoomed to Europe, North America, Australia, and New Zealand, and 31% couldn't see it, 25% could see it. There was significant light, said 31%, that's a third, very strong light in 5%, and intense to overwhelming light in 7.8%. Very good example of telepathy. Next slide. Minds can communicate by telepathy, and he says he can assess people at a distance, which I think he can. Next one. Any of you who want the paper, it's Neuroquantology, volume 17. Next, please. So why this disbelief? Next, please. The prevailing orthodoxy is Newtonian reductionist science, but is this correct? Well, we've heard from Alexander that it's clearly not correct, and Harold also has views that way. And the Scientific and Medical Network has got the Galileo Commission. Do you remember that Galileo wouldn't look, the church wouldn't look through the telescope? But this, in fact, its aim is to broaden science. Next, please. Now, I don't know if you all know about this. It's an astonishing initiative by Bigelow, the billionaire in Las Vegas. He called the world to submit essays of 20,000 words on, is there life after death? And he gave $500,000, and that was won by Jeffrey Mishlove. Do remember that name. And then came Pim van Lommel, and then came Rubric, and then there were a number of prizes. And I'm pleased to say that our group even got a little $20,000. So it's a fascinating initiative. So life after death has been pushed to the top of the agenda. Now, the last thing we're doing is looking at random number generators. Observation has shown that randomness can be affected by mind. Next one. There's the Global Consciousness Project you can look at. When the papal visit to Israel, the random number generators in different parts of the world changed, and also at the Climate and Peace Conference. Next. And the whole random number place has gone to Broughton Hall in England. This is from the Pear Laboratory in Princeton. And any of you interested should look this up. And if you want, you can go and try your ability to alter random numbers. So that is the work that we're doing at the moment. So thank you for the slides. And thank you. I think that's about 10 minutes, Sonia. It wasn't much longer. And
no, I'm sorry. You can, you can make some comments about that. I'm sorry. No, it was fantastic.
So exciting things going on. So mind can definitely affect the universe in precise ways. So we can look at that and do it through random numbers. Oh, and there was another slide, and we're doing it now as people die, because we know that deathbed visitors is a breaking in some way of consciousness. We know that when light comes in the room, it's breaking. We know when the dying person goes to visit somebody, that's another breaking of consciousness. We're just wanting to know if all this is shown up by alterations in the random generators. It's a really nice way of looking at things. Okay.
Thank you very much.
Okay.
I think, these are incredible, fantastic research, fantastic work that you are doing. And this is so important because it brings some facts. Like Dr. Moreira said, we cannot ignore facts. Those are facts showing that there is a realm of consciousness that does not completely depend on the physical body, and that survives it. And then there's communication, like, it's exciting what you just showed, Dr. Fenwick, about Alain Forget, and this is really exciting. And how can we explain this by conventional science? We need to be open-minded and then start to accept facts. So I would like to, and again, you can discuss further. I would like to pose a question here, because you all doing this elaborated research. Can you discuss the methodology challenges of conducting research on spirituality and health and medicine? You know, the things that you're doing, what are the most important challenges?
I'm not sure who that question is for, but
For yeah, I'm throwing, everybody can, you know,
yeah,
give their perspective.
well, certainly what we're doing challenges the standard way. The standard way that you die is you go in the UK, is you go into a hospice. Usually you haven't had enough preparation, so you get what's called terminal anxiety. And then they give you midazolam and you lose consciousness and you die unconscious. The question is, should we be dying unconscious? You see, we can't really answer that question until we know what people experience through the final stages of the dying process. And there's now a number of studies which are coming out, and this is the result of the Bigelow Prize, suggesting that the Tibetan bardos are something we can actually look at from this side. And so the idea that one can in fact follow the death process by looking at the shift in random numbers may in fact be useful in how we treat the actual dying. Give them midazolam, don't give them midazolam. What are you going to choose?
The biggest
impediment,
the biggest impediment in the in conducting research on religion, spirituality, and health, as I said earlier, has to do with not enough researchers in academic settings, but it goes beyond that, in that there is simply not enough funding support in order to do the research. So because this is not conventional science, so to speak, the major funding organizations tend not to see this as credible as other areas of science. So research, especially if done well, good enough to get it published in a journal, in a peer-reviewed journal, is very expensive, requires a large team of investigators that you know removes the bias from just having one or two people doing the research. And it really does require a team, and that bring a team together is very expensive. So that, I think, is one of the biggest barriers to conducting good research in this area. Now, you know, what's interesting to me, our experience, is that you don't really need to get funding support from traditional funding bodies. Yeah. What you really need is finding an individual who is willing to support the research. And there are many, many very wealthy people in the world who may have a commitment to seeing this research go forward, and they can simply write out a check to support the research that needs to be done. So it's not totally hopeless here. There are plenty of potential opportunities to get the funding support in order to do research, to do good research that is likely to be acceptable to other scientists when they review it.
Harold, I totally agree with you. Getting money from patrons to support your research in this field is enormously important. And usually they have their own interests in it. For example, in my field, they may have had a child who's died, and therefore they're happy to contribute, or there may be difficulties of that along those sort of parameters which cause them to.
I think that in terms of methodology, the first and crucial point is exactly to have very, very good methodology. We know that we doing this kind of unconventional research subjects, we will be asked to be even more strict and rigorous than in regular areas. So some weaknesses that are usually not taken in consideration in more conventional research, people will select and pay attention to this limitation. So we need to do really very good research. So the researchers need to be very well trained. I think this is an essential aspect. But said that, there is another different aspect. We need, since we are dealing with a different subject, a different topic, specifically regarding, for example, the spiritual experiences, we need to adapt the methodology to the object that we are investigating. So we need to grasp the spirit of science, not the letter of science, because we need to grasp the spirit of science to adapt it to the need of that object to be studied, to that goal of investigation. Because sometimes we see these people trying to just transfer a specific method directly to another topic, and it doesn't work well. For example, of course, I cannot, for example, I usually like to, I often use an example. For example, if I'd like to investigate the reproduction of pandas, the bear pandas. Of course, I cannot just put 2 pandas in my lab room and wait them to reproduce. It will never work. So it cannot work in that way. I need to adapt an environment. I need to go in their environment, spend a long time investigating, analyzing, creating conditions, and then seeing, observing the reproduction of pandas, for example. If I put 2 pandas in my lab and they do not cancellate, did not reproduce, I cannot conclude that, oh, pandas does not reproduce. Of course not. So I think that's the idea. We need to be very rigorous, but at the same time, very open-minded and flexible in trying to adapt the spirit of science to that specific topic. Because quite often people are in 2 extremes. In one point, valuing spiritual experience, but denying the importance of rigorous scientific investigation. And the other side, we have people in fact emphasizing science and sometimes using a very straightjacketed method to investigate spiritual experience. I think it cannot work.
But Alexander and Harold, really, have you found that junior scientists are very reluctant to look into wider spiritual experiences? And in one of the institutions I was in, there was somebody who was wanting to do meditation, and they had a class on meditation, but it was then stopped by the vice chancellor because he didn't agree with people learning about meditation, because it isn't real. It doesn't really work. And it was a waste of time and a waste of money. How do we protect our young researchers from having their careers terminated or cut short, really, by the rejection of subjects which are just beyond reductionist science?
Yes, Peter, that's an extremely good question. And there's no question that this is risky. This is risky, in terms of trying to develop a career, because, the people who are in control of the world basically are attempting to preserve all of the conventional standard beliefs and practices and ideas that are currently present in which they develop their positions on. So any young investigator who wishes to depart from that is taking a risk. Now, the question is, how do you protect those young investigators? Well, first of all, you have to emphasize that they need to get the training. You need to get the training so that they can do research within the current paradigm to develop their position, their expertise. I actually, when I do the training of people in our workshops, I tell them not to lead with their interests in religion, spirituality, and health, not to lead with them. Instead, to go into a conventional area and become a world-renowned researcher in that area. Then, once that's been determined, then they can depart into what they really are interested in and conduct research, therefore bringing their credibility along with them to the area, to the research area. So I think that is the strategy to take, is to not to just focus in on what may be unconventional research, because that'll be a what's called a anti-tenure factor. That's what David Larson called it, the anti-tenure factor. So don't go and don't be shooting yourself in the foot to start out with. Do the conventional stuff and do it very, very well. Do it very, very well. And then that reputation you develop among colleagues within the field will then transfer over into the work that you're doing in perhaps marginally unconventional areas.
This is actually very good that we touched upon this topic, because there was a question from one of the participants about that. How do we go about the rejection of conducting research in some topics, some areas that are, less accepted by the conventional science? So this was very, very important. I think that a researcher to go into this area has first to be very courageous, very persistent, and patient, because it takes a while to develop reputation, and I think that's the clue to it. So thank you. This is going to be very, very important for young researchers going into that direction.
I'd like to add something. I deeply admire people like Harold Koenig, Peter Fenwick, and many others who had the patience to build their careers in different areas, and later they brought their whole expertise to this field of spirituality. A great example of that was Alistair Hard. Alistair Hard, a British biologist. He would like to start his career investigate spirituality in 1930s, I think, something like that. But he was advised to keep that aside. And then he developed a very fruitful career as zoologist. After retirement in Oxford, he created the Alistair Hard Center and started investigating spiritual experience. But I think that it demands a lot of internal commitment and persistence, and to really do that, not get lost in the way, because there are many attractions throughout the life, and I think most people would get lost in that way, and it could be sometimes a kind of rationalization to avoid work in this more challenging area. What I can say by my own experience, because of the way that was paved by Harold Koenig, Peter Fenwick, and other colleagues, I was able to start my career exactly investigating spirituality. So I built my career investigating spirituality. I think this is now possible because of the great work of both of them and many others. I think it's possible, but we need to start doing a very good level of research and in more conventional areas of spirituality and science. I think that's the point. For example, the impact of religious attendance on depression and things like that, doing more conventional, basically using conventional epidemiology and other research, investigating spirituality in a more conventional way. So in that sense, you are starting building your career, but in a not so challenging or a not so challenging area. And after you get well established, you can go deeper and investigate more challenging areas. So I would recommend young investigators or those who would like to start, medical students, medical psychologists. I think it's definitely possible to start investigating spirituality and religion, but doing this in a very, very rigorous way to get respected. And then you can go deeper in these more challenging spiritual aspects.
Yes, I'm sure that's
Awesome.
right.
Thank you. Thank you. I would like to touch on some of the aspects of the results of research. So you're all doing research on spirituality and related to health. You're training researchers. And Dr. Koenig also talked about training doctors who are going to use this, the results of the research on spirituality in their practice. So what have you seen being transferred from the results of research that you're doing into clinical practice? My question is related to what I have observed, that clinicians know very well how to assess the spirituality on their patients. However, once they assess the spirituality, then it seems to me that there's some kind of broken path there, because yeah, I know about the spirituality, your level of spirituality, how you consider that and all, but it stops there. There's no continuity to talking to the patient about that, or helping the patient in developing that, or anything. So research is fundamental, as I have seen, to bring awareness that this is so needed. How do we kind of bring it to be more used in the clinical care? Anyway.
Well, what I found when I did my research early on, particularly into the phenomena around death, is that you go back to the hospices and you give them the results of your study, that you'd found so many people had deathbed visions and so on. And the medics really couldn't understand and take it. One of the heads of one of the hospices came up to me and said, you know, those things, I know you say they happen in my hospice, but have you got your data mixed up? And it was another hospice. And it's really interesting. But now, if you go back, all these things which were so foreign are in fact much more common, and people are seeing them. So I think that really just the uncovering of different areas and helping is important. For example, we've seen a lot of change, and there was a question of it in the chat, of psychedelic drugs, psilocybin, particularly ketamine. And the idea of using ketamine as a model of the dying process is actually coming in now. And I hope that in the future, that when you go into a hospice, you'll be able to say, I wouldn't mind an injection of ketamine to see what it's going to be like when I die. That will be the sort of change that we have, and much less fear on the part of those who are now terminally ill.
Before the others chime in, Dr. Fenwick, I think you are receiving some kind of spiritual communication there, because this was specifically a question from one of the participants to ask about the ketamine effect and the psychedelic drugs. But also in the treatment of mental illnesses. So we can talk about that later, but let me give the chance of Dr. Fenwick and Dr. Moreira to talk about.
You've switched your microphone off, Sonia.
I'm sorry. I switched it off too early. So I'm going to pass on the opportunity to Dr. Koenig and Dr. Moreira to talk a little bit about the effect, the results of research being used in clinical care.
I think that, as you said, we need to go step by step. First, clinicians are aware that religion spirituality is important to many people. Then, clinicians now, many of them know at least how to take a simple spiritual history.
Yeah.
Just this it is some kind of intervention, because just taking spiritual history, patients tend to evaluate as a higher quality the treatment received. And even just by asking about the patient's spirituality, they can start to think about that and even by themselves integrate this spirituality in their coping skills and things like that. So this is all. The next step now, I think, is exactly to train clinicians how to use this knowledge that they get from patients about the patient's spirituality, beliefs and practices and coping skills and things like that. And how can we use it and stimulate it in patients to use them in a positive way for patients. I think this is the next step. Professor Koenig probably will talk about this later, because he has developed very good protocols about how to integrate spirituality in different religious traditions in cognitive behavioral therapy. I think this is very, very important. We just published with another colleague, Mariana Costa from Brazil, a paper where we summarized what are the actual protocols, what are the techniques used in cognitive behavioral therapy, spiritually modified, that were tested in controlled randomized controlled trials. So we try to show to clinicians how to implement in their clinical practice the strategies that have been proven to be effective in clinical trials. So I think the next step now is exactly to teach clinicians how to integrate this topic. And certainly Professor Koenig has a lot of experience on that.
Yeah, I could not agree with Alexander more in that. I think that there's no question that the spiritual history is an intervention. That is the thing that many people forget. As Alexander said, it's actually an intervention. He did a great job of describing how it gets people thinking about these areas and realizing the importance of them. If the clinician asks about something, then many patients realize, well, this is something important. Maybe I should spend a little bit more time thinking about this. So there's no question about that. In terms of general medical care, interestingly, literally this morning before we started, I spent the morning updating our CME videos on our website, which we have 5 videos that are designed to help clinicians, particularly in the medical field, to begin to integrate spirituality care. So these are very highly quality videos. They cost over $100,000 in order to produce these videos, and they're for free in our website right now. You can just go. There are 5 that are up on YouTube, and you can connect up there and you can watch these videos. And it describes the rationale for doing it, for clinicians doing this, why should they be doing it, how to do it, and the research that supports their doing it. Now, the big challenge here is that many clinicians are so incredibly busy, especially physicians and nurses too these days, that they just don't have the time. But, you know, that's a big excuse. That's a big excuse many give who don't want to be doing this. For those who are already sensitive to these issues, this gives them an opportunity to learn how to do it. And it gives them permission to do it. Permission. It's okay to be asking these questions and to be addressing them. And in these videos, we actually don't depend on the physician. Now, this is again in the medical setting. If you're in a psychiatric setting, it is different. As Alexander suggested, there are actually, you know, spiritually, religiously integrated interventions that the clinicians can use in treating patients. But in the medical setting, you know, they just don't have the time. So we describe in these videos the role that the nurse plays. We call the nurse a spiritual care coordinator. And basically the nurse kind of coordinates the whole team. So it's the team that addresses the spiritual needs of the patient, not just the physician. The physician does the assessment. That's their responsibility. There's no question about it. But once the assessment is done, then the physician turns it over to the spiritual care coordinator, who may address some very simple things with regard to spiritual needs, but then they will connect them with a chaplain who is trained to address the spiritual needs of patients, or a pastoral counselor, again, who is trained to address these needs. Because physicians and nurses, other than addressing very simple spiritual needs, really are not trained to address these areas. So, and they're too busy too. They're incredibly busy. So we think that a team approach is much more effective than just the physician trying to do it. But again, the intervention is the assessment, and doing that in a kind, supportive way can really, really be helpful to patients, even if it only takes 2 minutes to do it.
Any other comment on that? I think this was a great answer, and very important for clinicians who are watching us and to try to, and I think, Dr. Koenig, the idea of developing a team is very, very important and very good. I hope that this gets implemented in clinics, hospitals, because as you said, doctors and nurses do not have time enough, and especially with the health care system, especially here in our country, and I think most countries, the doctors and nurses, they have a very limited time with the patient if it's an outpatient, especially outpatients. And a hospital is a different thing, but as an outpatient, it is very limited. So if they had a team, they could then send the patient to talk to the person who will talk to the patient and assess their needs and follow on with that. So I think this is very, very interesting. It's a very good proposal. Another thing that I was thinking is, have you seen, of course, we have seen the development of research in spirituality going in a very high speed nowadays. There are millions of papers being produced on this area and so forth, so on. So it's a steep curve upwards. What are you expecting for the near future in research in this area? What do you think would be the next step? What are other areas within spirituality and health that needs to be developed?
Yeah, I think it depends on what level you're asking the question. For example, supposing we just take the Royal College of Psychiatrists in London, and Alexander can talk about the World Psychiatric Association, but it was must be about 10 years ago now that we started the spirituality special interest group in the Royal College. And that has grown and grown and grown. And there are now about over 2,000 psychiatrists who are members of it. And I think what we're seeing is the fallout from this, in that spirituality is now using questionnaires like Harold has produced in taking a spiritual history, has spread out throughout the college. So what's the next step? I think the next step really is to have people who are able to understand and talk to some extent about their own experiences. And let me give you an example. At one ward round I attended, the junior came in presenting it, and he said, this person is thinking all about ghosts. And so we asked him, he said, yes, he keeps mentioning a Holy Ghost. And what is quite clear here is that he hasn't been properly educated in the culture of the hospital, because most of the people there are Christian, and Holy Ghosts are something that people talk about. So now that we've got the idea of spirituality fixed in as an academic part of the Royal College, the next thing is to make sure that we're able to wheel this out actually into the situation, really what Harold was saying. So what's the next step? The next big step, I think, is to understand really what people like Maslow and so were doing when they were describing spiritual experiences. If I had gone and talked about some of the experiences that I had, there's the possibility that one would then get an injection of chlorpromazine so that it would stop everything dead. And so we're now through and coming up to that state. How common are a lot of these experiences? How do they abut psychiatric syndromes, and how do you differentiate them from psychiatric syndromes? So I think that's the next step that I'd like to see tackled.
Dr. Koenig or Dr. Moreira, do you have any thoughts on how this research will evolve from here?
Well, I think that interventions are going to be, that I think is the next step, is testing interventions to address the spiritual needs or the psychological problems that people have. So Alexander has summarized a lot of the cognitive behavioral therapy interventions that use a spiritual approach, and that is absolutely critical in helping then to stimulate more research in this area. And I think the cognitive behavioral therapy platform is probably the very best way to approach this. The cognitive behavioral therapy, first of all, it's used, there are literally hundreds of meta-analyses showing the benefits of cognitive behavioral approaches to virtually everything, every possible mental, psychological problem, from insomnia to schizophrenia to not even mentioning depression to eating disorders. I mean, there's so much evidence currently showing the benefits of the cognitive behavioral approaches. And those approaches are very, very easy to integrate within a spiritual or religious framework, because simply all of the major religions in the world, the scriptures of the major religions, are largely cognitive behavioral. They have to do with the person's thoughts and their beliefs and fears. I mean, that's the core of what the scriptures are doing. And in fact, really, all of this was much before any of the psychological CBT interventions. This was going on for most of recorded human history, where the religions were used to help people think and view the world in a more positive way, and to behave in a more positive way in terms of caring for one another in a way that enhances both individual health and community health. So I think really testing these interventions that do work, that really do work, and take advantage of the person's religious and spiritual beliefs to boost the benefits, I think is absolutely critical. And as that research comes out showing those benefits, that is then going to boost the clinical practice, the movement into clinical practice.
Yeah, I totally agree that the moving to clinical interventions and also public health interventions, this is even more challenging, ethical perspectives. How can we integrate spirituality in public health policies, for example, in terms of suicidal prevention, drug misuse? So these are two major public health problems. And for these two problems, we have very, very strong, perhaps the strongest evidence of impact of religion and spirituality. And I'd like to hear, Dr. Koenig, how do you think we could integrate spirituality in this kind of prevention in public health approaches regarding, for example, drug misuse and suicide? What do you think about that?
Well, I think one of the biggest recent developments in this area is the movement of Tyler Vanderweel, Tyler Vanderweel, Alex, into this whole area of religion, spirituality, and health. This has been a major boost to the whole field, because he is, a PhD in mathematics from Oxford University and in biostatistics from Harvard. He has an endowed chair in the School of Public Health at Harvard. And so his writings are in the major public health journals throughout the world. The American Journal of Psychiatry, the American Journal of Public Health, the International Journal of Epidemiology, all of these major journals that are literally defining what is public health and what public health people should be doing. The writings from this major figure in these journals is starting to change the whole attitudes of public health people. But, so that is a big wedge, that is an opening then for the informing now of public people and public health about the evidence, which is, as you said, Alexander, its greatest relevance is in terms of public health, in terms of prevention of disease. And prevention is, like you said, suicide and substance abuse. There's nobody who's going to criticize the research there. It's so dominant, it's so powerful, no one can criticize it. I mean, these studies are, 80, 90% show the benefits of religious belief and practice on these outcomes. So I think that's a great place to start.
And regarding another topic for future research, as I said in my initial talk, I think that the religion and health field advanced very, very much, specifically, and the resistance was strong, but not so strong, because much of the current findings can be accommodated in conventional mainstream framework. I think one of the major challenges now is to advance further in the understanding of the spiritual experience in the spiritual life as a whole, and even go beyond what can be explained just by biological, psychological, and spirit and the social factors. I think this would be perhaps the greatest opportunity, or perhaps the greatest contribution of the field to science and to the human understanding of ourselves. I think this brave and bold, but at the same time rigorous and humble investigation of spiritual experiences is a very promising perspective for the future. But at the same time, I think it will raise even more resistance, because it will be much harder to accommodate the previous mindset.
I like your challenge. And this brings me, of course, very close to a hobby horse. And it's the idea of what have peak experiences contribute to our understanding of the nature of man in the past, and how is science interfacing with this knowledge now? And so we're moving from the idea of dual perception to non-duality of mind. And this is something which is going to extend and extend. I know you're both familiar with Jeffrey Martin's work, where he has given courses to convert people from the ordinary duality of mind to non-duality, where in fact the egoic structures become supervened by the unity of perception. So you in fact change the way that you look at the world and see the world. Now, it carries with it the peace that knows no understanding, the fundamental peace that everything is okay. And so the transition from ordinary everyday consciousness into these higher forms of consciousness changes the behavior, the thinking, and the world of the people who do this. Now, do we have to go up into Himalayas for 40 years to get our enlightenment? No, you don't. Do we have to pay thousands of dollars to get your enlightenment? No, you don't, because you can get it more cheaply. And so one of his cheaper courses, in fact, is something which is very much worth trying if people are interested in this. And I cannot see that this isn't going to be one of the ideas that finally sweeps mankind into a different state of consciousness. It's easy to do, it's effective when you get it, and has it got negative sides? Yes, it has, because the negative sides are that if you start thinking differently and behaving differently, a lot of your old thoughts fall away from you. And I've seen this particularly with people who've had near-death experiences. Some of those have gone non-dual, and then they quite often, their marriages break up and so on. So there is a downside to it, but if you're after change, then duality is the way that we're all going to go. Are you dual, non-dual? Yes, Alexander?
Thank you very much. I think we are approaching the end of this session. And I must say that this research and what you're doing is fascinating. And we have even a more fascinating view of how this will evolve. I love the idea of research into using spiritual practices and approaches that will help humanity in so many challenges that we are now facing. I would like to offer, like, maybe your few words to end the session. Let me start by Dr. Fenwick. He would like to make a few more comments to end.
What final comments? Yes. Thank you very much for a wonderful symposium so far. And I love the two talks. Not having studied Kardec in the extent in which I should have done, the action of the perispirit was something which I didn't really understand, but putting it in a quantum mechanical sense, I think is wonderful. And one of the things I'll take from this conference is the idea that thoughts are both a particle and a wave. So every time you think a thought, it's gone, but it's there. And so you have to tidy up your thinking. And I think that is really terribly important. So thank you very much for the conference and for letting me meet Alexander and Harold again, which is really a great pleasure. Thank you, Sonia.
Thank you. Dr. Moreira Almeida, your last thoughts?
Yeah, thank you very much for this opportunity. It's always wonderful being with you all, Dr. Koenig, Dr. Fenwick, and Sonia. And I think it's my message would be a message of optimism. I think the harder work has been done, but these great guys and others, we just need to go and follow their path and move the torch forward. I think that's the challenge. I think, and also I can tell the resistance that I faced have been much weaker than I had imagined in the beginning. So definitely because of the important work of these pioneers. So I would stimulate all young researchers who would like to start this sort of investigation, and even more senior researchers would like to start investigating that. I would strongly recommend and endorse this movement. Thank you very much.
Thank you. Dr. Koenig, your final comments.
Yes, as Alexander said, and we really haven't talked much about the senior researchers. I mean, these are individuals who already have a reputation in their field, that they can then use that reputation then to give more credibility to this whole area. So that is phenomenal. This is great. So, but the senior researchers do need to have some training in order to do the research in this area as well. So getting some training doesn't hurt with the switching of the senior researchers over into this area. The other thought that I had was the importance of getting this out to the public, to the public. We've talked about the role of public health and these things, but if you can get it out into the public, can push governments and researchers to be more receptive to this area. When you get the public involved, that becomes very important in terms of advancing the field. So getting this reach out, and the public is very receptive to this, very receptive. It's most of the resistance is from the scientists. So, that you could either, one strategy is to push people into the area. So you could push the scientists and the funding bodies and the governments into this area because the population wants it. They want it. So in any case, those are my final thoughts. And I agree totally with Alexander that there is great potential in this area, you know, for young scientists, for seasoned scientists. And it is so important for our human race, especially now in all of the conflicts that are going on around the world. You know, religion and spirituality tie people together. It is so absolutely essential for human health and for, as I said earlier, you know, for our civilization's health.
Thank you very much, Dr. Koenig. And I think you said something very important. The public wants to hear about what is being done in research. How can this push forward the medical care united with spirituality for their own benefit? And this is one of the purposes of the meeting like this, because we give access to everybody. There's a lot of participants in this meeting that are not in healthcare, but they are very interested. And I am sure that is the public who will start pushing so that we can have the medical care approach changed in the near future. And I hope this near future is coming really soon. And I cannot thank you all enough for bringing your knowledge, your experience to come to a meeting like this, dedicate your time and bring all these enlightened messages to the public who is here with us. Together with us, there is a number of healthcare providers, physician scientists, but there's a lot of people who are here because they want to hear what's going on and your valuable research. That's very important. And I hope that with this, we can inspire people who can contribute to promote research like this. We need that. So Dr. Moreira, Dr. Koenig, Dr. Fenwick, thank you so very much on behalf of the International Spiritist Association. Thank you.
Thank you very much.
Thank you. Thank you. Thank you, Alexander. Thank you, Harold.
I will stay on because I have a message from the International Spiritist Medical Association. And I'm not going to take too much of your time. I know this has been a long day and a lot absorbed for so much knowledge that is being shared with us. I would like just to share a little bit, 2 minutes, about the International Spiritist Medical Association. I would like our collaborators to put up a slide that we have. There we go, it's just one slide. And so as you know, this event is promoted by the International Spiritist Medical Association that has been founded, as many of you know, Dr. Marlene Nobre. And she was the workforce behind all the Spiritist medical associations. And when she developed these associations, there were few associations in different countries that joined. And nowadays we have 8 affiliates we have association, the Spiritist Medical Association of Argentina, Brazil, Colombia, France, Panama, Portugal, Switzerland, and United States. And two of them are getting prepared to join us, Uruguay and United Kingdom. The UK Spiritist Medical Association has everything ready to go. There's a lot of paperwork that has to be done and so forth, so on, to register the association before it joins the international association. So just to give you an idea, the International Spiritist Medical Association is an organization of other organizations. So our affiliates are affiliates from different countries. But in every country, they have their own affiliates. For example, Brazil has the highest number of affiliates because the Spiritist Medical Associations started first in São Paulo, Brazil, and from there it has spread. There are numerous associations in Brazil, and the Brazilian Spiritist Medical Association is the organization that kind of has all the other smaller ones, state and different places under their umbrella. So we have our role is to promote events like this, where all the other our affiliates can join and can promote, and they can also, we can give support to them so that they can develop their own events. We actually inspire and stimulate them to promote events in their own place, in their own country, because our main goal is to do what we have just done during this today's meeting, and will continue tomorrow, is to spread knowledge, to spread the experience of these incredible doctors, scientists, to enlighten people of that we are a spiritual being. We are not just a body. We are not a mechanical body. We are a spirit that thinks and that survives the body. But because of that, because we are a spirit inside the body that manifests itself depending on the state of the spirit, on their emotions, on their sufferings, on their experiences, the spirit experiences and so forth, so on, will affect the way the body is, the way the health of the body, the health status of the body. So it is important that we bring this awareness not only to the whole population, so they learn about themselves, but also to the professionals in healthcare, because they are the ones who will take care of all of us. So that is the main purpose of this meeting. And on behalf of the International Spiritist Medical Association, I would like to thank every one of you, because by coming to the meeting, you not coming because you are not coming, you are other, by attending this meeting, virtual meeting, you are giving us strength to keep on going. You are giving us the motive to do more, to work more, and to spread the word. So each one of you can actually be a seed of what we have done here to tell others, so more and more people will participate in the future meetings. Due to the pandemics during for these last two meetings, we only had the virtual meetings, which actually was much better, was a good step forward. We used to travel to different countries to hold our meetings. Now we can all assemble together virtually, which is fantastic. We can actually make this possible to people who could not otherwise attend the meeting because of would not be feasible for them to travel. So with that, I thank you very, very much. We have more tomorrow. So please remember to access the same link tomorrow, and we'll continue on. For those who still still have questions or so, you can either send us an email, or you can go to the International Spiritist Spiritist Medical Association website, go into the contact button and send us any message or any question you may have. So thank you all very much. Thank you, our heartfelt gratitude to our speakers and to everybody who worked so hard today, all our volunteers, our interpreters. Thank you so much. We realize how difficult it is to do simultaneous translation, and you came up to the challenge. You all are doing this as a volunteer, and we much appreciate that. We really appreciate it. Thank you all so very much, and may God bless us all. Thank you.